Hi, I'm Dr. Carlos Brun. Welcome back. This is a video on the parasternal window. Why do we use the parasternal window? We use it to assess hemodynamically unstable patients because we can see several parts of anatomy that could lead us to a quick diagnosis. The diagnoses we're considering for an unstable patient in this window would be pericardial effusion leading to tamponade, right ventricular failure with an enlarged right ventricle, both acutely or chronically, left ventricular failure, whether it's an enlarged concentric or eccentric hypertrophy picture or a regional wall motion abnormality, or gross abnormalities of the aortic or mitral valve. You can sometimes even see problems with the descending aorta or even pleural effusion. Finally, to be able to make these diagnoses and acquire this anatomy, you have to be able to acquire the image. Let's get to it. I want you to notice the difference on the probe is that I have marked the indicator notch with orange tape to make it easier for you to be able to visualize. Let's start with the parasternal window, third or fourth left intercostal space. We align the indicator notch with the right shoulder of the patient, and then we angle the beam down and we begin to see some moving of the heart. We're going to start optimizing this image in a moment. What we have done is aligned. We have an appropriate depth of 16 centimeters, and we begin to see the descending thoracic aorta. We're going to move slightly to the right, and we're going to begin to actually have less dropout of our image, where we can begin to see the right ventricle anteriorly. On the left-hand side of the screen, we'll see the apex of the heart, left ventricle. We see the valves of the aortic valve, followed by the mitral valve. You see the aortic root, the left atrium, and the descending aorta. If we decrease the depth, we can zoom in and get a better view of the valves. Once we've done our measurements and global assessment, we rotate our indicator notch 90 degrees. Please note that I'm resting my hand on the patient and I'm holding this probe in a pencil grip. We begin to see the mitral valve, but the view that we're interested in is actually the mid-papillary portion of the left ventricle. So I'm going to be tilting my beam towards the patient's left hip. Now, if I can't see anything, I may need to slide out laterally or lower. If those don't optimize my image, I go back to where I have a clean image and begin to angle my beam out laterally again. If I still can't get an image as such, I may ask my patient to rotate onto his left side. So here we're beginning to see the left ventricle. There's the mitral view, and we'll also see the anterolateral papillary muscle and the posterior medial papillary muscle. We can see the septum in between the ventricles as well. Nicely done. Let's summarize. The parasternal window is useful for assessing the hemodynamically unstable patient, specifically for making the diagnosis of several pathologies. Pericardial effusion leading to tamponade physiology, right ventricular failure, left ventricular failure, severe aortic or mitral valve disease, or even descending thoracic aorta dissection or dilatation. Remember, just because we've completed this module, you're still going to need to practice, 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 and get help with supervision. You're not quite ready to go ahead and use this on your own to make acute clinical diagnoses. So practice. And then finally, a few more tips. Remember the basics. You take a good grip, as described, the overhand grip. You pick the cardiac exam. You pick the depth at 16 centimeters to start. Remember the area, which is going to be the third left sternal border intercostal space, the alignment with the indicator notch towards the left shoulder. You rotate and tilt to optimize your image. Well done. We'll see you next time.